Good evening. It looks like it's in your hands. A measure limiting the number of hospital patients nurses can take care of is headed for the ballot next year. It's a change the Massachusetts Nurses Association says will keep you safer. And as WGBH News reporter Gail Huff reports, it's a battle they've been fighting for years.
In big numbers, Massachusetts nurses have been lobbying their legislators for 18 years, trying to pass a law mandating staffing ratios in hospitals. Failing to get any legislation passed, the nurses are now appealing directly to the voters. In a major campaign using social media like Facebook, the Massachusetts Nurses Association gathered enough signatures to get the Patient Safety Act initiative on next November's ballot. Now voters will decide whether to cap the number of patients one nurse can care for at a time. Under the Act, intensive care units would be required to staff one nurse per patient. Emergency rooms would staff one nurse for 1 to 4 patients. And medical and surgical units would mandate one nurse for every 4 patients. The union cites studies showing overburdening nurses with too many patients is linked to increased costs, complications, and mortality. But the Massachusetts Hospital Association disputes that, long arguing hospitals should be allowed to determine their own staffing needs. In 2007, Karen Nelson spoke on behalf of the Hospital Association.
We all want the best care for our patients. We all want the best nursing care, but there shouldn't be a government-mandated number that tells us what that is.
It's a question that now goes to the voters. I'm Gail Huff, WGBH News.
Many states have tried, but so far, California is the only state that's regulated patient-nurse ratios. My first guest hopes the Commonwealth will soon follow suit. Donna Williams is president of the Massachusetts Nurses Association and is a maternity nurse at Cambridge Hospital. Welcome.
Thank you so much, Emily.
And we did invite the Hospital Association here, but they declined to come. So this is something you've been fighting for years. They argue that putting a number is kind of going to confuse the situation, that it should be determined by a case-by-case basis, because sometimes you need 3 or 4 nurses to take care of very critically ill people, and that doing it by the numbers is kind of like trying to regulate something that you can't really.
This is really the most important legislation that we can actually put in place to protect patients. What we're looking for is a maximum number of patients that can be assigned to a registered nurse at one time. And as you showed earlier in your clip, it goes by the area of which the patient is in. For example, the ICU, that 1-to-1 is for a patient that really does need to have one nurse looking at them exclusively during an unstable period of time. There's language in the legislation as well as in the ballot initiative to allow for more nurses to be brought in when necessary and based on the patient's acuity at the time or their need for more services.
Is this something you really want people like me deciding?
Yes, I do.
I'm serious about this, because it would be like saying, well, what if the doctors felt like they needed more surgical assistants and they wanted me to decide, or police patrol union decides that we need more people at certain neighborhoods. Isn't it really up to the experts to decide this?
I think it's safe for me to say that the nurses are the experts in this. And
you should decide, but do you want me voting on this?
All of the research that we have on this area, especially regarding the staffing, the number of patients that are assigned to a registered nurse, it's very clear to have that limit actually makes it much safer for you to be a patient in the hospital. And it allows me as a registered nurse to be able to care for you the way that I've been trained to care for you.
If the Hospital Association went along with what you've proposed, would you say, oh, okay, fine, we don't need a ballot question, or do you want to make this law?
I think it needs to be made a law. It absolutely needs to be made a law. You can't have, you have to have something in place that governs this. There has to be a maximum limit to the number of patients assigned to a registered nurse. Certainly you can have more nurses assigned when the patient's condition warrants it, but most importantly is there needs to be a limit, and there is none now. There is absolutely no limit to the number of patients that can be assigned to a registered nurse.
Okay, we did get a statement this afternoon from the Hospital Association, and they said simply, the hospital community is opposed to making decisions about how to best care for patients by means of a political campaign. That's their words. There is nothing safe about staffing decisions made independent of the professional caregiving team responsible for each patient. So they're saying this is really a union issue, that it's a financial issue, and that's what your concern is.
This is a patient safety issue. Beyond, this affects every patient in the Commonwealth of Massachusetts. It's not a union issue specifically for hospitals that are a union environment. This is for safety for all patients in the Commonwealth and for all nurses in the Commonwealth as well.
But there is a political arm to this too, because the second part of the ballot question, or the second ballot, has to do with financial transparency. You want hospitals to be, I think they should be financially transparent about what they pay their CEOs and all that. But again, does it need to be a law?
It does need to be a law, because you need to be able to know where your tax dollars are going that are so earmarked for health care. And those resources need to be available to provide that care in the communities where it's earmarked for.
All right, so it looks like it could be on the ballot next November.
Yes.
All right. Good luck to you.
Thank you so much.
Donna Williams, thanks.